Urine is quite common in both genders, but despite the discomfort that it causes, some cases still go untreated. And the Urology Hospital in Pretoria says that the condition affects 1 in 3 older men, and many of whom suffer in silence and avoid social interaction. And they, as a result, become depressed and are likely to experience falls and fractures. And to tell us more about this from our Pretoria studio, we're joined on the line now by Dr. Laurie Blake, who's a urologist at the hospital. Dr. Blake, thanks so much for speaking to us this morning and welcome.
Thank you very much, Sakina. Nice to meet
you. Dr. Blake, first and foremost, what are some of the main causes of urinary incontinence?
So it differs quite in males and females. It's more common in females that we see it, but mostly it's what we call, say, an overactive bladder, where the bladder involuntarily just contracts and you leak urine. Say a weakened pelvic floor, where your muscles are not as strong as what they used to be when you were younger. That's why we see it in an advanced age. Neurological conditions is quite common, where you have nerve damage or trauma to your nerve or spinal cord, or brain trauma or brain lesions. Trauma per se to the urological tract itself can cause it, infections. And then, unfortunately, in some children, they are born with a urological abnormality, so it's congenital causes also.
So we very often hear that in women, as you indicated there, the weakening of the pelvic floor, and that would be associated with pregnancy and the like. But as it pertains to men, what are some of the more common causes why men suffer from this?
So with men, it happens with the increase in your age. As you advance in your age, your muscles of your bladder, which is basically a muscle, becomes weakened. And then if you have prostate pathology, say enlarged prostate, you have to void then against the obstructed system. And this becomes quite difficult as you advance, and your age and your muscle then weakens due time. And then you start seeing the incontinence. It also happens with trauma. Say unfortunately, when you do have a surgery that goes a little bit wrong, you can also get incontinence from that. Smoking causes it. If you have a chronic pathology from other reasons, these are all abnormal reasons that can cause it. Your increase in BMI also, unfortunately, as a reason that we're not 100% sure why it causes your urinary tract to deform like that.
And what are some of the myths associated with urinary incontinence?
I think one of the biggest myths is that you can't treat it. And I think it's actually like you guys were speaking and laughing, but it's not something that someone wants to talk about, unfortunately. And it's a very common illness. People are rather walking around leaking urine and finding other measures than coming and getting treatment for it. So those are some of the myths that we see, that it's something that you can't retreat and it's something that's going to happen as you age and there's nothing that you can do about it. That is definitely the biggest one that we see.
Which leads to that question then, Dr. Blake. Why are people suffering in silence? I mean, and as you say, sometimes they try to at least find ways to deal with it themselves. What are some of those methods as well?
I think what the reason is why people don't want to say that they are leaking urine. It's quite an embarrassing thing, and it's not something that you want to speak about at a dinner table or tell someone. And if you could rather speak to someone and say, listen, this is some of the problems that I have, you can get quite good help. With regards to treatment, there's multiple treatment options, but it depends on the type of incontinence that you have, and then we can actually make massive difference and improve your health, your mental health, your physical health. This is a major treatment that's not getting the good effect that it actually should get.
So how intensive is that treatment and how long does it usually take?
So this now differs from person to person, obviously, depending on how severe your pathology is. But say if it can go from behavioral therapy, teaching you when to go to the bathroom, physiotherapy, strengthening your pelvic muscles, to just a tablet that you have to take maybe daily, relaxing your prostate, or stopping your bladder from overactiveness. to more intensive treatment where we even inject Botox into the bladder, we stimulate the bladder with nerve sensory stimulation, neuromodulation, we implant basically a pacemaker into the spinal column, and then more intensive where we do anti-incontinence surgery where we basically give you an artificial sphincter where you can then open your sphincter and void when you want to and close it again.
Now, you said earlier that this is something that generally afflicts older men and I would say older people in general, but then given the intensive nature of the treatment, how costly is it, and is it something that is done at state hospitals as well?
It definitely is done at state hospitals. Just close to us here is Steve Biko, and we do a lot of the operations there as well. It's a quite common, if you pick it up early, you can make a big difference. The problem is that the patients wait and they start seeing lower urinary tract symptoms, and then take quite a long time before they come for further help, and that's where the problem is. If you come too late, it makes your surgery or the treatment options that you have less and maybe more intensive regards to what you have to do.
So do you have a long waiting list?
We do have a long waiting list in the state government, unfortunately, as in all of our hospitals, and that is an unfortunate thing that we need to work on regards to that in the state government, and unfortunately a little bit less in the private sector.
Dr. Blake, how long is long? How long would someone, have to wait if they're listening, watching the show right now and thinking, maybe I should have this checked out? How long would they have to wait on average?
So this now is a very difficult question that you're asking me because it's regards to a specific illness, but I actually did a study on it in our government sector where they do wait for a long time period, and this was just on prostate cancer. This is an unfortunate event, and that was waiting about 180 days just before you get treated on prostate cancer. I do not have the specific times on incontinence, but if you take into account if you have a cancer and you have to wait 180 days before someone treats you, just take into account less severe illness where you just leak urine, how long you will wait. So I can't give you an exact figure, but it will be, say, from the time that you realize the illness, a year before you start getting treated. That taken into account, the patients also do come late. They do not come early when they start seeing some of their symptoms, especially in the males, less so in females. You are more prone to come to a doctor for help than what males are, especially in this uncomfortable area.
So just a final question. If there's somebody who's watching this morning and they are, as you say, as we usually are, very shy to come out and speak about things that we find uncomfortable or embarrassed about, how would you motivate someone who suspects that they may suffer from this condition to actually seek help?
I would definitely make an appointment with your nearest urologist, and I promise you, you will get great results, especially in our country. We've got great urologists here. If you want intensive therapy, I would come to the Pretoria Urology Hospital for the pelvic wellness unit. That's where I'm working. This is specific regards to this condition. But go and see your GP first. If you're struggling to find a urologist, he'll refer you. If you're in our other sector, say state sector, go to the local clinic and they'll refer you as soon as possible and get going as quickly as possible, because the symptoms will only mostly worsen it. They won't improve. And this is something that we can treat quite easily.
Dr. Laurie Blake, thanks so much for speaking to us this morning, and urologist there at the Urology Hospital in Pretoria, talking about incontinence and how it affects us, and especially men who wait longer, who will not acknowledge this condition. If you suspect that you may be suffering from urinary incontinence, then do give your GP a shout, and if you can afford it, go and see a urologist. Let's take a break.